Hello there, you're now with me, Hendy Gui, and welcome to your 5 p.m. English news on TVS. Let's dive into the headlines for today. Vaccines given to individuals, especially those at risk, is based on the results of a clinical study. Therefore, Deputy Chief Minister Dr. Sim Kui Hian urged the public not to be influenced by the spread of misleading news about the COVID-19 vaccine. Commenting further on the matter, Dr. Sim said that the government has always done its best in protecting the welfare of the people.
AEFI is adverse reactions, and the adverse reaction is so small, and people has to be really, no doctors want to give you more trouble. We love you, we want to protect you, rather than we want to cause more trouble for you. So please don't listen to all the fake news. Please believe like the doctors. No doctors want to give you more trouble and later on way to treat you. But if you don't receive vaccination, right, and then you get sick, it gives us more trouble in the hospital.
Dr. Sim, who is also the advisor of the State Disaster Management Committee (SDMC), said that vaccination is the main component in combating the virus outbreak. In fact, the Sarawak government has continuously worked with related parties, especially the Ministry of Health (MOH), in realizing the success of the vaccination program.
And I want to thank the Jabatan Kesihatan, Jabatan Pendidikan. The most important is the KKN, YBKJ, Dr. Asmi, for really working very closely with Sarawak government and we do whatever we can, because we know that vaccination is a very key component in our war against COVID-19 in living with the virus. We need to do that.
Dr. Sim said so after visiting the National COVID-19 Immunization Program for Children, or PICITS, vaccination center at Batu Kawah Health Clinic on Thursday. At the same time, he also called upon the parents to be responsible and ensure that their children are registered for the vaccination.
Now, a total of 18,301 children aged 5 to 11 years, or 4.1% of the group in Sarawak, have received the first dose of the COVID-19 vaccine as of yesterday. Deputy Health Minister Dr. Noor Azmi Ghazali said 40% of the country's children population who had received their first COVID-19 dose were from the state. As such, he said the Ministry of Health Malaysia (MOH) has targeted 70% of children in the education system to receive the COVID-19 first dose within 2 months of its implementation.
Jadi KKM mensasarkan 70% kanak-kanak yang layak ke dalam sistem pendidikan dapat diberikan dos pertama dalam tempoh 2 bulan. Dalam tempoh 2 bulan ini. Dan dari sekarang dah 80% dari mereka diberi dos pertama lengkap dalam tempoh 6 bulan pelaksanaan. Sebab apa hari ini kita memfokus kepada PPB sekolah. Yang saya akan buat satu PS, satu press statement lagi esok setelah CITF akan bermesyuarat esok.
Dr. Noor added that the government and MOH are very concerned about the safety of children and took the first step to implement PICITS because the study proves an effectiveness of up to 90.7%. He said although the effects of COVID-19 infection on children were not serious, the government was still concerned and urged parents to register their children on the MySejahtera application to get their vaccination.
Malah adalah lebih bahaya kalau seseorang kena COVID daripada diberi vaksinasi. Kesan sampingan daripada vaksinasi ada sangat-sangat kurang. 86 juta rakyat di kanak-kanak di Amerika, di US telah diberi vaksinasi, hanya 11 yang dapat myocarditis umpamanya. Dan itu pun semua sihat. Semua dah beri rawatan dan sihat. Jadi saya nak sarankan pada semua rakyat Malaysia, jangan bimbang, jangan takut, malah kita patut rasa terpanggil dan bertanggungjawab untuk mendaftar secepat mungkin anak kita sebagai dependent dan menunggu panggilan appointment daripada MySejahtera ataupun kanak-kanak yang akan diberikan di PPB sekolah. Saya suruh semua dengan penuh tanggungjawab kita lakukan ini demi menyelamatkan anak-anak kita.
Apart from that, Dr. Noor also commended the Sarawak government's effort in implementing PICITS earlier than other states in Malaysia. Meanwhile, the number of children aged 5 to 12 years old that are eligible for pickets is 286,000, which is 10.1% of the total population in Sarawak.
Over 62,000 or 1.7% of the population of children aged between 5 and 11 in Malaysia have received the first dose of COVID-19 vaccine as of Wednesday. The Ministry of Health has set an interval period of 8 weeks between the first and second dose in its effort to achieve herd immunity through the National COVID-19 Immunization Program for Children, or PICKIDS.
According to the Ministry of Health's COVID Now portal, a total of 12,769,610 or 54.5% of the adult population have received their booster doses, while 22,933,328 individuals or 98% of the adult population have completed their vaccination. Meanwhile, 99.2% or 23,208,714 have received at least the first dose of the vaccine. For the adolescent population aged between 12 to 17 years old, a total of 2,793,710 individuals or 88.8% completed their vaccination, while 2,871,310 individuals or 91.3% have received at least the first dose of the vaccine. The cumulative dosage of vaccine given under PIC up to date are 64,434,353 doses.
Thermal scanning before entering the premises of educational institutions under the ministry is no longer mandatory. The Minister of Education Malaysia MOE has declared that the removal of the mandatory use of thermal scanners to scan body temperatures from the Standard Operating Procedures SOPs effective February 11th.
However, all teachers and implementation group members, service workers and visitors are still required to scan the QR code through the MySejahtera application before entering any premises registered under the MOE. Meanwhile, as a safety measure, parents or guardians are requested to ensure that their children or ward is in good health and asymptomatic before allowing them to attend school sessions. MOE said the health status of students while at school will be monitored continuously to ensure that students with symptoms are isolated in isolation rooms for further action. At the same time, the ministry also recommended that this ruling also apply to all educational institutions that are not registered with the MOE.
Now, the growing populace and the increasing demand for food supply have stimulated the adoption of smart expertise for agriculture. Hence, Sarawak is expected to witness a healthy development and produce possible development opportunities for locals to tap into the profitable market in the near future. All of us are aware of the gentleman's agreement between Gabungan Party Sarawak and BERSATU, in which a declaration was made by the BERSATU president before the previous Sarawak state election that the party would not be fielding its candidates in Sarawak. The question remains, will the unwritten pact be honored and the consensus met in the upcoming general election?
When asked if incumbents who are now BERSATU party members in retaining their seats, Parti Pusaka Bumi Putra BERSATU PBB Vice President Datuk Sri Dr. Stephen Rundi Utom said in response that the victory should be in the hands of GPS.
At the end of the day, the top leadership will decide. We will see, and the decision must be consensus. Whoever stands there, bottom line, GPS must win the seat.
On another question, will Datuk Willie Mongin step aside and let PBB contest in Puncak Borneo? This is what Rundi said.
Well, it depends if he thinks that, initially there was an understanding that BERSATU will not put their candidate in against GPS. So I leave it to Willie Mongin.
Now wrapping up the 5 p.m. news, the Ministry of Education, Innovation and Talent Development paid a visit to its counterparts Ministry of Higher Education in Putrajaya, Kuala Lumpur recently. And among the matters discussed were the issue of visa application for foreign students studying in Sarawak, technical and vocational education and training and institutions of higher learning, and the collaboration that can be carried out with the central government at the Sarawak level.
The delegation was led by Sarawak Minister of Education, Innovation and Talent Development, Dato' Roland Saga Wee Ind, together with Assistant Minister of Talent Development, Dato' Francis Harden Hollis, Assistant Minister of Education and Innovation, Dr. Anwar Rapai, Permanent Secretary of MEITD, Dato' Kamri Effendi, and other officials. Dato' Roland Saga and his entourage also paid a courtesy call to the Minister of Science, Technology and Innovation, Dato' Sri Dr. Adam Baba, in Putrajaya, Kuala Lumpur. The meeting was for further discussion related to science, technology and innovation that can be developed and explored by Sarawak. Besides that, among the agenda that was given emphasis by MEITD are programs that can be implemented in Sarawak and the steps to commercialize the products that have been developed. At the same time, during his visit to Talent Corporation Malaysia, the main focus of the meeting was to find out more about how Sarawak can manage and coordinate talent development in the state. Talent Corp Malaysia, represented by its Group Chief Executive Officer, Thomas Matthew, welcomed the arrival and the relationship between the federal government and the Sarawak government.
And that concludes the 5 p.m. English news for today. Once again, I'm Hendy Gui. Stay safe and have a pleasant day.